IBS treatments and managing IBS.
Hey there, this is Jason Green of the Detox Authority. And today I want to shed some light on a chronic condition known as irritable bowel syndrome, or IBS for short. Now, IBS is actually an umbrella term that is used to describe a whole host of symptoms that can cause bowel dysfunction.
Now, because there's no blood test or an x-ray that can be used to diagnose IBS, to meet the IBS diagnosis, the patient has to have a certain set of symptoms that occur over a set period of time. And among those, the most prevalent one is continuous abdominal pain. Now, if you have continuous abdominal pain and it's associated with 2 out of the 3 following features, relieved only by a bowel movement, associated with a change in frequency of bowel movements, meaning going from less than 3 times a week to more than 3 times a day, and 3, the abdominal pain or discomfort is associated with a change in consistency of bowel movements, meaning you go from loose watery stools to hard lumpy stools, or vice versa. And if you meet 2 out of these 3 criteria over a 6-month period, then you meet the criteria for having IBS. Now, the actual cause of IBS is not completely understood, but there is a key factor which involves a miscommunication between the brain and the gut, and that affects how fast or slow the bowel moves. So you can get diarrhea if it's moving too fast, and constipation if it's moving too slow. And the reasons that cause this miscommunication between the brain and the gut are many, including dietary factors like food allergies or food intolerance, sustained or chronic stress from lifestyle, and genetics, meaning that in some cases IBS can be inherited. Now, the 3 main subtypes of IBS, or the groups which most patients fall under, is based on bowel habit. And there's IBS with diarrhea, IBS with constipation, and IBS with mixed pattern, meaning that the patients have both diarrhea and constipation within hours or days of each other. The symptoms of IBS with diarrhea are associated with abdominal pain or discomfort, cramping, bloating, and that gripping feeling that can stop you in your tracks. It's also associated with loose or watery stools, or going to the bathroom more often than normal, which would be more than 3 times a day. Now, other symptoms that patients with IBS with diarrhea have is a sense of urgency, and that urgency can come out of nowhere and completely take over your life. Treatment for IBS with diarrhea in general starts with Pepto-Bismol, Imodium AD, and the like. Starchy foods like saltine crackers, rice, or potatoes are good, and in some cases, low doses of antidepressant drugs have had a normalizing effect on the bowels. Now, on the alternative side, there's been some great success in clinical trials with acupuncture and Chinese medicine. Psychotherapy and hypnosis can treat the emotional side effects of ongoing diarrhea, whereas internal cleansing or a quote-unquote detox can address potential dietary and other factors like toxicity and the acid-alkaline balance or pH balance in your body. Patients with IBS with constipation typically don't go very often, but they can go multiple times a day, mainly because they don't feel like they fully ever evacuate. The symptoms associated with IBS with constipation are mainly hard or lumpy stools, dry pellet-like stools, decreased bowel frequencies, meaning going less than 3 times a week, and also straining. Hemorrhoids and anal fissures can also be some of the side effects as well. The treatment of IBS with constipation is pretty typical for how you would treat another patient with chronic constipation without the diagnosis of IBS. Usually one of the many over-the-counter laxatives or stool softeners will work to increase bowel movements. Epsom salts and castor oil are 2 old-school remedies that still work for a lot of people. There are also some great alternative options like aloe vera, rhubarb root, probiotic capsules, and internal cleansing or detox, to name a few. IBS with mixed pattern is a difficult group to treat because it can change from loose watery stools to hard lumpy stools or vice versa within hours to days. Other patients will have a pattern where they will be constipated for 4 or 5 days or even a week, and then they'll have a lot of pain and dramatic loose stools, almost like the bowel is trying to empty itself. Now, I really believe that IBS can be cured or at the very least contained and managed because your body is always working hard to achieve a state of balance or what is known as homeostasis among each of its systems. Your digestive system is no different. So if you have IBS or suspect that you might have IBS based on the symptoms I just described, it would make sense to explore every possibility toward healing and permanent recovery. And that includes traditional medical advice as well as the growing number of alternative therapies that are becoming more and more effective without the negative side effects. Okay, so if you enjoyed that information and you want to get more, I have 20 more free videos I can send you on the top questions that people are asking about detoxification and internal cleansing. Plus, I'll throw in a free copy of my ABCs of Detox Quick Start Guide. And this features 20 of my very best insider tips and tricks for people who are just getting started with detoxification and internal cleansing. All you have to do is go to www.detoxauthority.com/access. That's www.detoxauthority.com/access. I'm Jason Green, and here's to feeling better right now.